One of the case studies that we've worked on it was Betty, lady in her 50s, and she was a wheelchair user. She worked with a disability group around volunteering for supporting people on personal budgets and direct payments, and felt fairly confident about the process. But that changed quite a lot when it was her turn to be assessed. She had a meeting with a social worker, and it went on for nearly 3 hours, quite gruelling. One thing she wanted was a more structured approach to her day, and she was really interested in getting in touch with a choir that she'd been in with before, but needed help to actually access the building and to get from the car into the building. However, when she had the assessment, which had been quite an ordeal with the length of time it went on, that she found that the allocation that she had under a personal budget was nowhere near what she'd had as a direct payment, and she couldn't afford to pay a personal assistant for as long, which was causing a lot of problems. It really restricted her. The support plan which the social worker had signed off, it wasn't really clear, and she was left wondering what exactly she could spend the money on. She eventually came to the advocacy service wanting to know a little bit more about how she could make things work better for her. And we agreed to act as advocates and a sounding board, and went to the other meetings with her in the future, just more for moral support than anything. We were also able to give information about making a complaint to the council about how she'd been treated, and helped to get in touch with the local councillors to highlight the problems that she'd experienced. This time round, when there was a review of the personal budget, Betty had felt a bit more in control, because the support plan was written in a way that she understood, and it really made more sense. So she knew exactly what she could and couldn't do with the money, and eventually found that she felt so confident with the support plan that when it came to meeting with the social worker, she could meet on her own and sign off the support plan. And then it was really satisfying afterwards that she rang the advocacy service and said what a difference it had made just knowing that she wasn't on her own, and being able to support her to speak up for herself and make sure that her voice was heard. She's now using that experience to work on consultation work with other disabled people for the local authority, and helping to spread good practice.
Helen, could you tell me something positive that you feel that CISL has gained from being part of the MIP project?
I think from a personal perspective with the advocates, it's been really useful to know that the experiences we've had with the council and continuing healthcare, that it's difficult to get anything out of the officialdom for the local disabled people isn't an isolated incident. It's the same all over the country, so that peer support has been really useful.
Okay, brilliant, thank you. And could you tell me one difficulty that you've had around delivering advocacy in the personalisation process in Doncaster and Rotherham?
It's been quite difficult in a climate of restricted budgets. We're working to try and maximise the support that people can get to enable them to live as independent and full lives as possible, and that's been quite a challenge with the very limited budgets, and we have had to challenge people quite a lot, more than we would have had to in a less financially restricted climate.